Good morning, everybody. We're going to go ahead and get started. Welcome to the Group Corner webinar series with today's special guest, Ed Lightcap from UnitedHealthcare. I'm your host, Gregg Amato, and here's my contact information on the screen. I'm the Director of Employee Benefits for Northeast Ohio for the past 2 years. If you are located in another part of the state and have questions, please contact one of my colleagues in your area. Also, if you're not licensed, appointed with UnitedHealthcare, or for that matter, any of our other partner carriers, please contact your local Cornerstone representative, and then we can have Sandy Weber, our Director of Licensing, start the process for you. Housekeeping item, if you have questions during the presentation, please feel free to type it in the box located at the right side of your screen. We will answer questions as time permits. Cornerstone's rewards trip is back again for 2020. It's called Cruisin' in the Caribbean, and it's through the Royal Caribbean Harmony of the Sea Cruise. The travel dates are from May 3rd through May 10th in 2020, and qualifying dates started this year on 1/1 and end and continue through 12/31 of this year. Points are earned for writing new business, both in the individual medical and ancillary lines, and as well as the group medical and ancillary. So please visit Cornerstone's website to register so that we can begin tracking your progress. Cornerstone has a resource center that's found on our website, and it's generously filled with information, guides, tutorials, and other educational materials. All this information is categorized by lines of business and is available 24/7, including an archived presentations of the Group Corner, which we're listening to today. For 2019, we have an enhanced lineup of webinars. They are the Individual Corner, Build Your Brand, Tech Tuesdays, Cornerstone Corner, and of course, today's presentation, the Group Corner. Please take time to register for any of these upcoming sessions on our website. All of these webinars are designed to improve your skills and to help you grow your agency. And now I'd like to introduce today's special guest presenter, Ed Lightcap of UnitedHealthcare, who will be presenting information on their level-funded product, All Savers, as well as Motion, HealthiestYou, some underwriting updates, and upcoming changes. Ed?
Hello, everybody. My name is Ed Lightcap. I'm a small group sales rep account executive for UnitedHealthcare in the Cleveland, Ohio market. So I work with Gregg and any of the brokers that are in Gregg's market for UnitedHealthcare. Today, I'm going to be presenting on our small business All Savers product, which is our level funded product. This product has been selling a lot in the last year, and it's what we really focus on in our small group 1 to 50 market because it is an underwritten product. So it is a way to get an underwritten rate for groups that also have, community rates available, which tend to be a little high. So a couple things I'm going to go over today is just quoting and underwriting our All Savers portfolio, our All Savers wellness programs that we have that are really great, and specialty benefits. So a lot of times when I do meetings, I talk about average total number of employees, AT&E. And I know this is kind of boring, but I always like to mention it because we determine at UnitedHealthcare in the state of Ohio what size a group, what size segment it should be quoted in by the average total number of employees. So a lot of you already probably know this, but I just always like to make sure because it's always best that we start quoting a group in the appropriate size segment because there's been a handful of times in the last few years where we've quoted a group, let's just say in the 1 to 50 market, and then we are selling a group, and when we get all the sold group paperwork, the AT&E count happens to be 51 or more, which is a different size segment, different products, and different roles. So AT&E is just determined by basically the complete average of all the employees in the previous calendar year. So that's going to include all employees that are full-time, part-time, seasonal, basically all W-2 employees. It also includes owners and partners that may not be a W-2 employee but are K-1 employees. So just wanted to point out that it's pretty important to let us know during the initial quoting process what the AT&E count is for groups. If we don't get it, we usually push back because we always want to quote things appropriately in the right size segment. And one little note that I have on the very bottom of the screen is that AT&E is used for Ohio situs groups. So if we are quoting a group in another market, most of our states are AT&E states, but there are a few states that use a different determination. So if we have any quotes in those other states, we just need to verify that. For all savers, now I'm going to I only work in the 1 to 50 market for all savers, or I really should say 5 to 50 market, because we only go down to groups with 5 enrolled employees or more. But we can sell all savers up to 99, just to let you know. And this is just the basic information on what we need. It's nothing earth-shattering. It's just a member-level census. We always need a group's physical address, not a P.O. box. What their AT&E count is, tax ID number. If the group does have an AT&E count of 50 or less, we need the current carrier name. Just to let you know, all we need is the name. We don't need the renewal. We don't need benefit summaries, which we would if the group was 51 or more. So the extent of our information we need about their current carrier with the groups that are 50 and under is just the carrier name. And the main reason we ask that is because we don't want to quote a group that already may be with UnitedHealthcare. We can quote existing groups that are community rated with all savers, but it's a different process, and you'll need to work with Cornerstone and the UnitedHealthcare renewal rep to get a quote for all savers on existing business. And just a couple other little things. Commission. Commission is anything that you want. So it's always as a per employee per month. If we're not asked up front what you want, we just standardly put a built-in $20 per employee per month commission. But if you need more, or in the rare cases you need less, we can quote that and it will impact the rates. And the last thing I really have on there is participation is 50% of all eligible employees must enroll. With UnitedHealthcare, we don't look at why people are waiving, whether we consider them a valid waiver or not. We don't exclude people that are valid waivers from the participation calculation. All we do is look at how many full-time eligible employees there are and how many enrolling there are. And as long as there's 50% or more, then we can quote this. And this participation rule is the exact same as our community rated product. Now I have underwriting requirements here to get an underwritten rate. And for just to let you know, if you ever receive an all savers quote from us and it says preliminary quote, that means it has been underwritten. Okay. We are going through a change right now on how we underwrite groups, and I really want to highlight that. Let's just say currently, and what I mean by currently is for any group that has an effective date of 6/1 or earlier, so 5/1 included, we will be still underwriting groups with 20 plus enrolling employees with our member level census, the GRX, but that is going to be changing. So starting with any quote with a 7/1 effective date, to get an underwritten quote for all savers, we are going to need employee applications. We currently require employee applications for groups with 5 to 19 enrolling employees, but starting with 7/1 effective dates, that will be for groups with 5 plus enrolling employees. We do allow, and most of our submissions are on FormFire. So we do accept FormFire all savers applications to underwrite groups. But in the rare case a group will not do FormFire, we would allow paper applications. Or if you have a quote where maybe somebody is completing FormFire, but you have an employee or two that refuses to do it, you can have the entire group do the FormFire applications other than the couple that will not, and you can have them fill out a paper all savers application. That would be completely fine with us. One thing I always want to point out too is that our employee applications are only good for 90 days from the effective date. So if we're quoting a 7/1 effective date, for instance, we will need all the employee applications to be dated by April 1st or later. If the applications are older than 90 days, we will push back and ask for updated applications. I know a lot of times that's not so easy to do. So an option that we do sometimes is, for instance, I got a quote yesterday from a broker for a 7/1, and all the employee applications were dated in the beginning of March. So we could not quote and underwrite it for 7/1. We basically decided to quote it for 6/1 so you can get an underwritten rate to kind of see where we are. But ultimately, if we quote that for 6/1 and the group wants to move forward with 7/1 with us, we will need to get those applications updated and requote it for 7/1, which will include about a 1% increase for the trend from 6/1 to 7/1. Now, I'm going to get into some of the product portfolio for All Savers. UnitedHealthcare has always been guilty of having a lot of plan designs, not only the number of plans we offer, but a lot of different type of categories. We are being mindful of that, and you will soon learn that we are going to be ratcheting down our All Savers portfolio sometime later this year. But a couple things I wanted to point out are important things that can help save some premium. So with every plan that we have in our All Savers portfolio, we have what we call an EPO version of every plan. And basically what that is just a medical plan that has no out-of-network benefits. So it's in-network only. These plans save about 2.7% if you compare it to the comparable plan that's identical. That's like a PPO version, okay? UnitedHealthcare's network is so large that we rarely get any people seeking coverage out of our network. Obviously, it happens, but it's extremely rare with UnitedHealthcare. To give you an example, every hospital in the state of Ohio is in our Choice Plus network, which is the network we use. But just to let you know also, EPO plans are actually on our Choice network, which is a national network, and it's the exact same network as Choice Plus. It's just that when you sell a plan that says Choice Plus, that means that plan has benefits without a network benefits. If you just quote the Choice network, that's our EPO plans, and that just means that there's no out-of-network benefits. So I would say we haven't been selling as many EPO plans as we used to a couple years ago. So I just want to focus on these plans because, again, it's 2.7% savings roughly, and they still get our large national network. And I think it's worth almost the 3% premium savings to offer these programs. So definitely take a look at those plans. Next plans I'm going to talk about. For 9/1/2018, we updated our All Savers portfolio to include new plans that are called LX plans. So if you ever see a plan code on a quote and it has LX as the last two digits of the plan code, that basically means that's one of these plans that we came out with in September, and the only difference with these plans is lab and x-ray benefits are covered at deductible and coinsurance versus giving them 100% coverage for lab and x-ray. Just by modifying these benefits, we save roughly about 7% versus covering those benefits at 100%. So extremely significant rate reduction by offering these plans. We automatically quote all of our LX versions of our PPO and EPO plans. So those are traditionally the plans you're going to see on our quote. If you do need a plan where the coverage is 100% for lab and x-ray, just let us know and we can still quote those plans. But the vast majority of the plans that we're selling nowadays are either LX plans or HSA plans. You know, one thing to point out too, I talked about the EPO plan saving a little under 3% and the LX plan saving 7%. If you would take an EPO version of an LX plan and you compared that to the comparable PPO plan, you're roughly saving 7% by modifying the benefits to exclude out-of-network coverage and lab and x-ray at deductible coinsurance So really good price decrement. And again, that's where we're getting the vast majority of all our sales today. It seems like all the other carriers actually took steps earlier than All Savers and made lab and x-ray be covered at deductible and coinsurance. So we're more in line with some of the competitors now. Now here is kind of a feature of what our future portfolio with All Savers is going to look like. Usually we make changes in our All Savers portfolio once a year, and usually it happens on September 1st. Most likely, this is kind of, I put a little snapshot on the bottom. This is just an early sneak peek, which it is. You're actually the first agents that are hearing about this that I work with. And we're going to make our product portfolio easier by getting rid of a bunch of plan categories. They're listed on here, so we're going to get rid of our advanced plans, our primary focus plans, our flex focus plans. Those are all plans that have modifications to benefit to save some premium, but they weren't selling. So we had very low membership in those plans, and our thought is it's going to be easier for everybody to understand our portfolio if it is ratcheted down a little bit. So we'll be removing all those categories. Most likely it will be for 9/1 effective dates, but again, we'll let you know when that happens, when it's officially announced. Another couple options that we're going to probably retire also is plans that have flat dollar copays for PCP and specialist. So traditionally, most groups that we see selling are taking a split copay where they have, let's just say, a PCP copay of $25 and a specialist copay of $50. These flat dollar copays, it would be a $25 PCP and a $25 specialist, which we were not selling those plans. So we're going to be retiring those plans, and that's a lot of plans that we're going to be reducing from our portfolio. And also we have a number of PPO and EPO plans with 50% coinsurance, about 20 plans. We'll be getting rid of those plans as well because those seem to be selling. So again, all the plans we're getting rid of are very low membership. If you do have any existing All Savers groups with UnitedHealthcare, though, or we sell one before these changes are made, we will allow the group to renew to their current plan. So as much as we're removing them from our portfolio, that's going to be, we're just removing it from our new business portfolio, and feel assured and safe that any plan that they're currently on with All Savers, they will be able to renew to that plan next year. Now, here's a plan name guide that I made up for All Savers that a lot of people ask me, and probably Gregg too sometimes, where, what do these letters and numbers mean with our All Savers plan? So here's a little guide that kind of explains it. Obviously, there's a number that say Flex Focus and Focus P and Advanced P. Those are all the plans that we're getting rid of. Any plan that you see that starts with a P is just our standard PPO plan. And any plan that you see that starts with an E, either has an E as the first or second letter, those are usually going to be our EPO versions of the plan, again, with no out-of-network benefits. And then on the very bottom, it indicates, if you have a plan code and there's a bunch of descriptive letters and numbers near the end of the plan name, this is a little guide that kind of highlights what those mean. If you would have our All Savers product grid that we updated last year on October, this key is going to be there as well on the bottom of our product grid. So more to come about our future product portfolio that will roll out eventually for probably 9/1. But I kind of wanted to give everybody here a little sneak peek and give you a little teaser on what we're thinking about doing in the near future to try to help you guys out. Now, one thing that we're real proud of with All Savers is our wellness that we have built in. So with All Savers, we have 3 wellness components. Motion is one of them, HealthiestYou is another, and then Rally is the third. We're real proud of all these services that we have. We really feel it's making an impact, and they're really good value adds that employer groups and brokers are really happy about. So I'm going to be focusing on some of these programs, and specifically a lot with Motion. So basically, one thing that everybody knows that's probably on this call is a lot of cost of healthcare is due to poor health habits. And, maybe about 5-10 years ago, everybody was talking about people that are smoking and that leading to high cost claims. And nowadays, it's more people being active throughout the day and throughout the week And a lot of people nowadays with jobs where they just maybe sit at their desk, or just maybe people that are being more not doing a lot of activity throughout the day, obviously that leads to possibility of some poor health and some possible chronic conditions to be happen in the future. So right now, only about 50% of adults are given a physical activity they need to reduce or prevent chronic diseases. 85% of annual healthcare costs are for people with chronic conditions. So if there's anything that we could do to help people that either already have chronic conditions or may not yet, but are maybe on track to get some, we're trying to do what we can to prevent that. It's estimated that about $117 billion is spent annually with costs associated to people with inadequate physical activity. So motion is here to address that. Obviously, if people increase their engagement in walking, their health's improved, and that leads to lower costs and healthier lifestyles, and usually better mental states for people, and also just being all more fit and active and happy with their life. So we're going to throw out incentives with our motion program, which is basically paying people to hit certain walking requirements throughout the day, which is obviously going to lead to loss of weight, improve cholesterol and blood sugar, increase energy and productivity, decrease symptoms of depression and anxiety, and overall reduce the risk of diabetes and heart disease. Now, this slide right here is basically showing how employees can earn money. So with our motion program, people that are enrolled employees and also their enrolled spouses can participate in our motion program. They will need to get, let's just say, a walking tracking device, pedometer, and we only have certain ones that we use, and we'll be going over that as well. But basically, we didn't want an incentive program that basically just rewards people for doing how many steps they do in a 24-hour period. We are doing that, but there's also other activities to earn money throughout the day and throughout the weeks and months. So we have what we call our FIT goals. The F in FIT stands for frequency. So not only do we want people to do a lot of steps throughout the day, but we want to see people being active throughout the day, not just one big burst of activity throughout the day. So for frequency, we will give any employee $1 that does 6 7-minute walks throughout the day. Those need to be, it says in the little asterisk there, a minimum of 500 steps within that 7 minutes, and they need to be an hour apart from each other. Again, we're trying to promote activity throughout the day, just not large bursts of activity. And this helps reduce things like cardiac health and increases people's metabolism. So anybody that meets that goal gets $1. Anybody that does intensity, which does 3,000 steps within a 30-minute period, will get $1 for that activity. And then there's the tenacity goal of just doing 10,000 steps in one day, and that's $1. So you could either earn $0, $1, $2, or $3 every day with this motion program. If you basically earn $3 every day, if you look at the end of the calendar year, 365 days, that means that person would have earned $1,095, and that's pretty significant. $3 doesn't sound like much, but when you add it up over the annual period, it does add up to some significant dollars. And again, this is for every enrolled employee and every enrolled spouse. So if somebody is enrolling employee spouse coverage or family coverage, collectively between the spouses, you can earn a little less than $2,200 in an annual period. Now, I mentioned we do need certain devices to be used with motion. We have, this basically goes over all of our motion devices that are compatible with our program and available for employees and spouses that are enrolled to purchase on our motion website once they get installed with UnitedHealthcare. Recently, we introduced the Apple Watch, so we're real happy about that. So if you look on here, this is basically just a print screen of what somebody would see when they log into our motion site to register. The most basic device that we have is that first one called the Strive Bio 2H. That has a retail price of a member price of $55. But one thing that I'll be talking about in a couple of slides after this is we do give everybody that's enrolling in motion in the first time a $55 credit to use to purchase a device if they already do not own one that's compatible with us. So at the end of the day, for people that are enrolling and want that Strive Bio 2H, even though the price is $55, we're giving a $55 credit. So at the end of the day, they get that for free. Now, one thing I will let everybody know too, whoever is participating in this call right now, Gregg will be doing a raffle after the call for everybody that joined, and we will pick one name, and that person will get one of our Strive Bio 2Hs. So we'll be sending that to you. We'll let you know who wins, and we'll let you know, and we'll send it to you as well. But that's worth it's a $55 value that we're going to be sending to one lucky winner on the call today. One thing to point out here is the third device is the Fitbit Charge 3. This is brand new. We previously were selling the Fitbit Charge 2 on our store, but since there's a new version of it, we are now offering the Charge 3 on our store. And then you see here too the Apple Watches. We are offering the Series 3 and Series 4 versions, and obviously there's different capabilities of each one, and those cost make the prices different based on if you want cellular or not. So they can purchase an Apple Watch, either Series 3 or Series 4, on our Motion online store. Okay. The next page is what we call BYOD motion devices. So these are devices that are going to work with our motion program. We do not sell these on the store anymore, but if an individual that is enrolling in motion has one of these different devices, it will be compatible with our motion program, and there's no need for them to purchase a new one for use of for motion. If they want to purchase a new one, that's fine, and they can get the $55 registration credit. As you see on here, the Fitbit Charge 2 is now a bring your own device, so because that's the older version and we're only selling the newer version. It indicates here for Apple Watch, if somebody has an older watch like a Series 1 or a Series 2, those are still going to be compatible with our motion program. But we're going to have some people that may have an older Apple Watch that want a new one, so they can purchase the either Series 3 or Series 4 through our store. So again, between the ones that we are selling on this page and the ones that you can bring your own, we have a decent amount of devices that are eligible with our motion program. When we came out with motion for the first time 5 years ago, the only thing we were offering was this trio that's here, that is the belt clip pedometer. We've made great strides and added a lot of devices. So again, if a member owns one of these devices already that are available for purchase, or one of these ones that we allow them to bring their own devices, they do not need to buy a new one because it's going to be compatible. But if they want to buy a new one, as I said before, they can. The one little note I want to mention, though, is the Apple Watch. The very, very first Apple Watches that came out were actually considered to be Series 0 Apple Watches. Those watches are not compatible with our motion program. So if somebody has one of the very first ones that were offered, they will need to get a different device to earn the motion dollars. I already mentioned before that when people are registering for motion, they get a $55 registration credit, and here's just a little brochure on that we have on this. If you see on number 2, it says if you can use your $55 towards the activity tracker to be shipped, which is one of the ones that I indicated on the purchase slide a couple slides ago. But if somebody is registering and already has one of the devices that are compatible with us, they're just going to keep their $55 registration credit. So that's just a little kicker for people. Again, I have it listed on here in the little orange thing. This is, again, eligible for employee and spouses. So we're really trying to make some of these devices really affordable by giving people a $55 registration credit. So if they don't already have a walking device or already have one that's not compatible, they can get one that basically is going to be no cost for them. Now, we also have a unique program that we started. When we introduced the Apple Watch at the beginning of this year, we have a unique way for members to pay for the Apple Watch where they do not pay for it up front and can actually use the dollars they earn by walking to pay off the Apple Watch. So this is the only device that we're allowing people to walk off is the Apple Watch. But the nice thing about this program is when somebody is purchasing the Apple Watch, and it'll indicate what the cost is, they could indicate that they would like to pay the watch off by walking it off by earning this certain motion credits. So basically, they will have to pay a little fee to get the Apple Watch, and it indicates that right at the first dollar sign, they're going to be paying the taxes, administrative fee, and shipping and handling at time of purchase. And then they will start walking, and the dollars that they're earning for the motion will pay off the cost of the Apple Watch. Now, just to let you know, at the 90-day period, so this is going over in the middle of the page, we're going to look to see that they met at least some minimum requirements of walking and earning dollars, because if they're not, they're really not going to be paying off their device. So the only thing that we're going to be looking for is over the first 90 days, they need to, on average, just earn 3 motion dollars per week. That's not very much at all. You're probably not using the device that often or not doing a lot of walking requirements. So just to let you know, if they're not earning $3 per week over the first 90 days, we will basically end the Walk It Off program, and their credit card would be charged for the remaining balance of the Apple Watch. But if they do meet that requirement, they keep walking, they keep earning credits to pay it off, and basically at the end of 6.5 months, any motion credits that they've earned will be used to pay off the Apple Watch, and any remaining balance that there could be would be charged on their credit card. So with this Walk It Off program with the Apple Watch, it's allowing people actually an opportunity to be really active, and at the end of the day, earn a free Apple Watch with the Motion program. This is just a little slide of how it works, and it's just basic. It's just members need to create an account online when they after they're enrolled with UnitedHealthcare. That's when they're going to get the $55 activation credit. They need to purchase a device online if they don't have one that's compatible already, and it will be shipped to their address. And then once they get it, they should begin walking and sync it weekly. And then they start earning rewards for employees and spouses of $3 a day. The goal of UnitedHealthcare is to have at least 60% of the employee population of group participation in Motion. And it was very low when we first came out with it, but we've been making really great strides by adding additional devices. And we are basically almost at that goal. This slide is showing the significant results that we've experienced so far with Motion. So if you look at comparison 1, people that are enrolled in our Motion program on average are doing 12,000 steps per day, which is really great. If you look at the industry and people that are wearing activity device trackers, the average person does 8,000. And it's not listed on here, but I believe the average for people that aren't using devices, their average walks per day is 6,000. So we're seeing people that are enrolling in this program have a significantly high average number of walks per day than the normal population, and that's what this program is designed to do. Also, almost 90% of members are still walking after 6 months with our program. Traditional programs like gym membership, after 6 months, you only see about 22% participating still. But with our program, we still see after some time, people are still being active and still using our program. Our member participation right there shows it's anywhere between 45 and 65%. That depends on what state that you're in. Our goal is to hit at least 60, but we're on track to be there extremely soon. Now, one thing I really wanted to go over too is how the motion credits are actually paid out. And also with All Savers is a level funded, alternate funded program. So it's technically filed as an ASO. We make it look and feel like a fully insured plan by guaranteeing a fixed composite rate throughout the year. But we do provide employers that are performing well and have, let's just say, low utilization, a possibility of a refund. So basically, we will, any surplus that is a group has from what they're expected to hit and what they actually do hit, any surplus, the employer will get 50% of that surplus back. Now, we don't calculate the surplus until the 15th month because when we look at the first 12 months are with us, we won't have all the claims at the renewal date, and we won't even have all the claims, after the first month. So the 15th month they're with us is when we calculate if there's going to be an employer refund or not. If they do have a surplus on the 15th month, we will send 50% of that surplus to the group via check on the 16th month. And one thing I listed in the parentheses there, the group must be active with All Savers to get a refund. So for any group that is up for renewal and doesn't renew with All Savers or leaves within the first 4 months of their renewal with UnitedHealthcare, when they leave us, they are foregoing any refund they would get. And just to let you know, we do provide monthly utilization reports that are available on our My All Savers website for you to access for each one of your groups. And also the group can access it through their employer portal. So you can look out every month and you'll see a utilization report, and it kind of lets you know if you're on track for getting a refund or not. But ultimately, we won't know that until their 15th month they've been with us. And we're real happy to say that in the state of Ohio, 38.5% of all of our Ohio All Savers groups are getting some type of refund. Some of them are small, some of them are pretty significant. But since it's an underwritten product, we know the health of the groups usually when we put them in. And right now, a little more than 1/3 of all groups are getting some form of refund check on the 16th month. Now, next is I want to talk about the motion credit payout. So I mentioned about how motion works and how they can earn $3 per day. But motion credits are paid out quarterly, and they must have at least $20 for us to pay them, for us to make the quarterly payments. If somebody is on an HSA plan with All Savers, which we have a lot of enrollment with our HSA plans, money is deposited directly into members' HSA bank accounts. Now, for those who have been selling All Savers over the number of years, you may realize that at one point we only would make deposits into our Optum HSA bank that UnitedHealthcare owns. So groups would actually have to move to Optum HSA bank for their employees to use motion and for us to deposit money in HSA accounts. We have ended that, so they could use any banking institution for their HSA, and we will make deposits for the motion credits they earned into that account. When a member goes online to register for motion and they pick their device, all they need to do is indicate what their HSA bank is, and then every quarter we will deposit all the money that they've earned into their HSA account. Now, it works differently for people that are not on an HSA plan. So if a member or an employee is enrolled in a non-HSA plan, we will only reimburse credits like an HRA. So let's just say, for instance, somebody in a quarter had $150 worth of medical claims and earned $250 in motion credits. We are only going to reimburse the claims that they paid out of pocket, which is for any services, deductible services, co-insurance, all co-payments. So basically what would happen is we would deposit the $150, or not deposit, we would send the employees a check for $150 automatically. They don't need to do anything. That would mean that there was $100 that they earned in motion credits that we didn't pay out yet, and that will just roll over to the next quarter for future use. Once a year, though, annually, any unused credits that a member have earned but not used because they didn't have enough claims, we will roll over 50% of unused credits annually. So with the HSA, you're going to get everything that you earn. With a non-HSA plan, we're only going to pay out motion credits earned for claims paid out of pocket, and then any surplus that they've earned through the calendar year, 50% of that will roll over on January 1st. Okay. Now, I've done talking with motion, but there was also some other important wellness activities we have with All Savers. Virtual care is something that's really popular nowadays, and with All Savers, we have the HealthiestYou virtual visit program. So members will be able to access and do virtual visits, whether over the phone, over a smartphone, via Skype, or FaceTime. They'll be able to do all that with HealthiestYou and see a doctor virtually instead of seeing a doctor at their office. There is no cost for HealthiestYou at all. So all these services that people use for virtual visits will be free to a member. Part of HealthiestYou too is that we have a program called Best Doctors that we introduced at the end of last year. And Best Doctors is basically like a second opinion program. So there's a lot of times where members may have some treatment or some care they need or some diagnosis, and they kind of want to have a second opinion. HealthiestYou has Best Doctors and allows people to do a virtual visit for a second opinion with a specialist of that they need. Now, I put on here a couple things. The things highlighted in orange is really important. So HealthiestYou is a free service for virtual visits. And what I mean by that is it's not billed as a claim. So if somebody's on an HSA plan, a lot of plans that carriers have, and you're on an HSA plan, they still need to meet the deductible and pay for the virtual visits because they're on an HSA plan, and it's being billed as a claim underneath the HSA benefits. With All Savers, HealthiestYou is not billed as a claim. It's just an added value. So even people that are in HSAs will have free virtual visits without impacting their HSA deductible because it's not a claim. This also helps out for employers. So since we do provide a refund for groups that are running well, if you have a lot of your employees accessing care through HealthiestYou, since it's not billed as a claim, it's not showing up as any claim dollar, and that's just making the possibility for a refund even greater for our groups. Now, it says right here, Best Doctor started effective 8/1/18 with us. And one thing that's real important to point out is we do an in-depth expert medical review when people reach out. 45% of the time, we are correcting or modifying a diagnosis of people that are reaching out to Best Doctor, and 75% of the time, we are either correcting or modifying the treatments. So this program is having some really important, significant results in helping people get appropriate care and helping people get appropriately diagnosed. With the Best Doctor program, this is why people are calling us. So it's a little blurry, and I do apologize about that. But 4% of people are calling with an unknown diagnosis. 7 people don't understand their diagnosis. 10% are skeptical of their doctor's recommendations. 20% are questioning the need for their surgery. 35% symptoms not improving. And 24% they need help deciding on appropriate treatment. So this is an extremely valuable program that we are offering at no cost to the employees whatsoever. So definitely promote this with your groups, and because it's really having an impact in making people more satisfied, and in a lot of cases getting them either appropriate care, treatment, and appropriate diagnoses. Another value of HealthiestYou is we always know that there are some times when an employer is moving to All Savers and an employee is enrolling. Sometimes they don't always enroll their dependents, whether it's their dependent children or their spouse. But with HealthiestYou, if somebody enrolls employee only with All Savers but has dependents, HealthiestYou actually allows a member to enroll their dependents that are not enrolled in the All Savers health coverage to actually use the services of HealthiestYou. So again, they just need to go onto the website or the mobile app, add their dependents, whether it be spouse or children, and those spouse or children at that point, once they're added, can actually access HealthiestYou at no cost as well. Great service that we're providing for non-enrolled dependents. And then lastly is our Raleigh Wellness Program. This is something that's been around for a while. It's basically they would just go to our member website and take a health assessment, but it's kind of gamified, I will say. So it's a little fun to actually go through it and finish. Just ask a number of questions about their health and lifestyle. At the end of it, they'll get basically a Raleigh age, and people usually compare their Raleigh age to their real age. Last time I took this last year, it said my Raleigh age was 5 years older than what my health habits are today. So once you do the Raleigh and finish it, they will let you know recommendations for missions or simple activities to improve your diet and fitness and mood. So it is a really great program to help employees identify things they need to focus on to become to live a healthier lifestyle. Also on our website, we have a healthcare cost estimator tool. So there's a lot of times where employees are having some treatment and they don't know what the cost of that treatment is until they actually already have it and get a bill. But with the healthcare cost estimator tool, members can actually go out there and for certain treatments and procedures, we will list all the different providers in their service area that would be able to provide that, and down to the penny what the cost would be for that bill. Probably the most popular use is for people receiving MRIs, because the cost of an MRI could be thousands of dollars difference between where you get it. So more your large hospitals, if you get in that hospital setting, it's probably going to be really expensive and a few $1,000s. But if somebody would go to a freestanding facility, it could be $1,000 to $2,000 to maybe even $3,000 less than some of the large hospital systems. So we have that cost estimator tool out there for people to use and to get either appropriate care or look at what providers we have and what costs for certain conditions, so they could be the decision maker on where they get their healthcare needs and how much they pay. That's it for Motion right now. Not Motion, but All Savers in general and the wellness programs that we have. One thing that I'll point out with Motion and Raleigh, those are usually programs that are built in some of our fully insured products too. So Motion is not exclusive to All Savers. So usually with fully insured, we build Motion into some of our HSA plans, depending on size segment. And then Raleigh is usually something that's built into all fully insured groups, because it's through our website, myuhc.com, or our mobile app, Health for Me. But lastly, I just want to touch briefly on some specialty. UnitedHealthcare also offers specialty benefits. So we offer things like dental, vision, life, short-term disability, and long-term disability. We do give a package savings discount if you're selling medical with us and other ancillary lines. These ancillary lines do have to be where the employer is contributing to the cost of the premium, so we do not offer package savings for voluntary ancillary benefits. But this kind of guide goes over what that discount is, and this is specific to groups that are 1 to 50 to let you know. There is a U bundle kind of program that's similar for larger groups, but this is specific to small groups 1 to 50. People that are enrolled in dental and medical get $3 per enrolled employee per month off the invoice for the employer. Vision is $2, life is $1, and short-term disability is $1 also. And then the more lines you sell with us, the larger that package savings discount is. I will point out that we do need certain participation requirements, so we do require 75% participation in these ancillary lines and the employer contributing to some of the premium. So not all groups get package savings, and I just wanted to make sure that you guys were aware of that. And then one thing that we did new earlier this year was orthodontia is now available to smaller size groups. So if a group has 5 eligible employees and 4 enrolling, we will now be able to offer orthodontia with our dental coverage. Here's just a little slide about dental. We are a full ancillary carrier. We sell a lot of ancillaries. And don't only look us for when you're trying to sell medical coverage with us to place dental. We are a full ancillary carrier, so we could do standalone any type of product that we offer, whether it's dental, vision, life. So basically, if maybe our all savers rates or fully insured rates are not competitive, but our ancillary rates are, please keep us in mind as using us as just a full ancillary carrier, since we do allow standalone vision and dental and life and things like that. Our dental network is really large, so definitely keep us in mind, and we can do voluntary dental down to 2 enrolled, and again, as I said before, standalone dental. And then lastly, I have a slide on here about vision. We could actually do voluntary vision down to 1 enrolled employee. Again, we can do standalone vision as well. Our network is extremely large with UnitedHealthcare. We do use the Spectera vision. For those that don't know, we don't really put Spectera branding on much of the UnitedHealthcare stuff, but we do own Spectera, and that is the network we use. And it's got a great mix of 53% of our vision providers are large retail chains, and then 45% are just private practice doctors. So we have a really good mix. I know some ancillary carriers have maybe more retail chains and others have more private practice. We have almost a 50-50 split between both. We have 49 of the top 50 top retailers in our network. And then we added Warby Parker to our network in 2018. Warby Parker does have an actual physical location now in the east side of Cleveland, but when Warby Parker first started, it was more of an online vision provider. It's becoming extremely popular, and we are the only carrier that has a contract with Warby Parker, whether they use the services through the online store, through the website, or they go to one of the brick and mortar facilities. So again, we're extremely happy to have Warby Parker on and be their exclusive healthcare provider that they contract with. So again, keep us in mind for any ancillary lines, whether it's with medical or not. So that's going to be the extent of my presentation today. As I said before, we will be doing that drawing, and we will let that lucky person know who won. And then I appreciate everybody's time and help. Hey, Greg, I didn't know if you were going to jump on or if there's any other last questions or housekeeping things we needed to do.
Yes, I'm going to jump right back on. Thank you. You had lots of great information here presented today. We do have a question for you. At what size group are multiple plan options available?
Well, you know what? I'm not only glad that was asked, I feel embarrassed that it didn't answer that up front. So there's no size limitation. So any All Savers group we sell, the group can take as many plans as they want. It's not limited to a dual option, 2 plans. You could offer 3, 4, 5 plans. You could actually, if you want to, offer a number of plans and not have any people enrolled in the plan, and we will still keep that plan open for future use. So no limitations on size segment or number of plans you can take. The only thing I will mention is when you get an All Savers quote from us, any plan on that quote you can sell together. Now, I did mention how we moved to our new LX plans, but we still have the opportunity to sell the plans where lab and x-ray is covered at 100% coverage. We do not allow an employer to sell an LX version of a plan and the exact same, any plans that have the lab and x-ray covered at 100%. So when you're selling with us, you need to either have all plans have lab and x-ray at deductible coinsurance or all plans with lab and x-ray covered at 100%. But that has not been anything that's really come up because the majority of all the plans we're selling are the LX versions.
Excellent.
Thank you so much for whoever asked that, because that's something I was planning on touching on and I just forgot to. So I appreciate that.
That's great. I don't see any more questions, so I'd like to thank Ed for presenting today and to all of you, our partner brokers, for taking time out of your busy schedules to attend this webinar. Thanks again, and have a great day. We'll be in touch with the winner of the device. Thank you.
Thanks, everybody. I appreciate your time.